looking at the data, do you foresee that?
Here where I live in Ireland, we were very strict in our lockdown, and in the country as a whole, which is a population of just under 5 million people, we were getting about 7, 8, 9 new infections a day. We're now up to 70, 80, 90 a day. So we had thought that we had pretty much covered it. There were still restrictions in place even when we were low, but there's been spikes again. The county that I live in is now in almost full lockdown again. So the point I'm really making is, I think you just need one person in a society to remain, influencing other people.
So in the presentation, I provide the statistics for Hubei province, where Wuhan is located in China. And if you trust the data, is that once that curve flattened, there were no more infections. In other words, that the spread of the disease was totally controlled by social distancing, wearing of masks, rigorous monitoring of buildings, in the context of a competent and powerful state. But I think we need to draw a distinction between the economic impact of a lockdown in Ireland or New Zealand or any country where with a healthy social welfare system, as opposed to one in South Africa where you have, by various estimates, 30–40% unemployment, massive level of poverty, where the state support for those is very limited. I think they're talking about 500 Rand a month. So it's in that context that the impact of malnutrition and other levels of deprivation cannot be ignored. So, and the scenario I present is that, is it better to have 25,000 deaths from poverty or a far smaller number from COVID?